independently predict successful weaning parameters. So try to maintain higher pulse pressures. That is what is required, where the success rate of weaning is much higher in these patients. Okay. Now, what are the parameters what you look for? First thing is look for the serum lactate levels, which is very important. Higher the lactate levels, higher the incidence of hypoxia in the tissue. Tissue hypoxia is very high in this. Okay, and this high lactate levels indicates higher mortality in all these critically ill patients. Okay. That is one of the important biological parameters what we look in. Now coming to echocardiography, I was telling you about, especially in VA ECMO patients, wherein we have instituted a VA ECMO to support the cardiac status. That is, in these, what we require is, if the LVOT VTI, the velocity time integral more than 12 centimeters per second is a good criteria for weaning, or you do a tissue Doppler, routinely it is done. If you do a tissue Doppler, and if the systolic tissue velocity is more than 6 centimeters per second, then it's a good indicator for weaning. And of course, look routinely the two-dimensional echo, look at the function of the heart. What is the EF? You try to calculate. Of course, this is what I am showing here in this thing is this is quite a sick heart if you look at it. The heart is virtually dancing or wobbling around. This is a very bad heart. This is not an ideal candidate for a weaning process. Okay. And of course, like I said, it is not only the systolic function which is most important, it is the diastolic function which is most important. Try to assess the diastolic function, whether they are in grade 2 or grade 3 diastolic dysfunctions. Those are the important criteria for the weaning. Now, what about the lungs when we want to wean a patient from? Most important I want to talk to you here is about, suppose you have